The Rachael Heyhoe Flint Award. Named after Wolves' former vice president and sporting pioneer, this award recognises outstanding contributions to the local community. This year awarded to all of the staff of the Royal Wolverhampton NHS Trust in appreciation for their incredible efforts to care for us all in response to COVID-19.
Unwelcome but expected, the coronavirus has hit the UK.
A further 46 people have died in the UK after contracting the virus, with 3 of those deaths here in the West Midlands. 2 of those were in Wolverhampton, the other in Dudley. The national total now stands at 303.
Well, we knew that we were likely to have a number of patients with coronavirus. We didn't know exactly what was happening. We'd heard the stories from China and from Italy. And in fact, we'd started our planning before they'd started the national planning because we knew it was going to happen. But we didn't really know it was going to happen so quickly. So within 48 hours of when we were sitting down talking about what we were going to do, we suddenly had our first patients. And over a weekend in March, we had 8 or 9 patients who were very, very ill. And of course, our planning, which had been going on for a number of weeks, really came in at that point, and we knew that we would pile all of our resources into looking after these patients. But they were sick, and sick quickly, and our intensive care unit quickly filled up. And I must say, our staff were unbelievable, because it was very scary for them. They suddenly had to start working with protective equipment on. And it affected everybody. So, the cleaners, the porters were as involved as the intensive care doctors and nurses.
It is remarkable, and I think that cumulative daily stress, I think to begin with, people probably just thought, well, we've got to get on with it. And then when you have time to stop and reflect and appreciate what it is that you've done, or what we have time to reflect and appreciate what it is that they have done, then that's when it takes it out of the normal. I think most people in a challenging situation would just say they do what they need to do. They act as a team and they manage it. But when they stop and think about what they've done, they should be really proud, really proud.
It was interesting. I spent some time talking to our cleaning staff about how they were coping with it all. And in fact, they were incredibly motivated and positive. It was all about looking after local people, because they all come from the local area. And it was really impressive how the team worked together. And so you see the glamorous things that happen on television, perhaps people in PPE dealing with very sick patients, but without the portering staff, without the cleaners, without the nurses on the other wards initially, we wouldn't have been able to cope. They were absolutely magnificent. And I think one thing which is quite unique about Wolverhampton is, we've got 10,000 staff, the majority of which come from originally and live in Wolverhampton. There's a lot of trust. If you look at the staff feedback each year, it's one of the best hospitals in the country. All of that trust means that when you say you've got to do something quickly, they really go the extra mile. They work really hard. And because the patients, many of them know the patients because they come from Wolverhampton, it's a family feeling, and that commitment was unbelievable. It was really fantastic. You could feel it. I was around the wards, walking around, looking at intensive care, and even though the workload quickly escalated, people were very calm. They knew what they were going to do, and it worked out really well.
That's something which is always noted in people who come to Wolves, is just how much of a family feel there is to Wolverhampton. It's curious, isn't it? But I know I'm from this neck of the woods and was standing in an old version of this stand the last time we got to a European semi-final. So it's one of my favourite memories. So I've been coming here and paying 2 and 6 to get in through the turnstiles, and when we had old money. So I've been around here as a fan for a long time, and then working here. And Wolverhampton's a great place. So gets a lot of knocks, but it's a great place. And I think a lot of the players appreciate that.
The former players and Carl Henry and co were magnificent. Even I hear Glenn Hoddle and people who hadn't had a direct association with the club for years were right behind the support. And the current players, and again talking through Matt Perry, were incredibly supportive. So financially that's been really helpful, because it's added to what we have got through our normal sources. It's helped equip some of the new wards. But emotionally, we shouldn't underestimate the fact that when you've got staff who come from Wolverhampton, looking after people who are patients from Wolverhampton, to know that players, recent and old, from the club also support that city, our city, is really, really important, because it means that people will carry on working and going that extra few yards for the people. Everybody's in it together, and it really still feels like that now, coming towards the end of what hopefully is the pandemic, but certainly the first wave. We still feel that everybody is with us and moving in that direction, and I think without that it could be quite lonely for people.